Welcome back to the TrailBLAZER Pod. I'm your host, Faye, and each week I bring you stories of Jewish women who are trailblazers. In this episode, we feature Jennie Berkovich, a board-certified pediatrician who's breaking barriers in the medical world. She shares her journey from secular upbringing to becoming a leader in the Jewish Orthodox Women's Medical Association, known as JOWMA. Jennie emphasizes the need for preventative health measures and culturally sensitive communication. We discuss the changing landscape of the Orthodox community, and she shares insights on time management and balance. Let's dive in. Jennie, welcome to the TrailBLAZER Pod. How are you today?
I'm good. I'm super excited to be here.
So happy to be here with you today. I know you're usually on the other side of the mic, so I'm glad to be doing this. I like to start off with my guests and ask them about their early context, how they grew up, anything they're willing to share. I think it's a really nice way of setting a foundation for somebody.
Yeah, so I was born in Russia and I grew up there until I was 7. I was born into a very secular family, but at the time, so it was like the early 90s. I'm going to date myself here. It was very challenging for Jews to be, I think, in a lot of places, but certainly in Eastern Europe. And so at that time, it was really like the tail end of like a mass migration of Jews from that part of the country to either Israel or America, depending on like where you were able to get in and get sponsored by other family members. So I came here with my family when I was 7. I spent my childhood in Chicago, went to high school, went to college, and then I went to medical school in Florida, and I spent the next 10 years of my life in beautiful sunny South Florida before coming back to Chicago just a few years ago.
What a difference. Okay, I didn't know this. You said you grew up very secular. What was the journey there? Because I know now you're Orthodox and you're very involved in the Orthodox community. We're going to be talking about that. So how did that happen?
Yeah, I think every Baal Tshuva gets asked this question a lot. I think some people have like really amazing and inspirational stories. I'm disappointed to tell you that like mine is really anticlimactic. I was lucky enough to live in a very Jewish area growing up. So even though there was not a lot of Yiddishkeit there, it was like very normal to be Jewish. So I was surrounded by like culturally Jewish things really my whole life. And then when I moved out of that community, moved into college, it was very near a frum community here in Chicago. And so it was like a very kind of organic transition, I would say, once I was introduced to like this way of life. And so I tell people it kind of found me, like it was kind of happening and I didn't really know what was happening. And I don't know, all of a sudden, I guess I was keeping Shabbos and kind of never looked
That's so interesting. I think though, you're saying anticlimactic, but I think most of life happens like that. Like we don't always have a moment we can pinpoint or a cool story. I think it's way more organic and, relatable that it was like this for you, I think, Thank you for sharing. So you went to medical school, you're a pediatrician. I'm curious, was there like something that inspired you this? I know some people that I talked to, they knew when they were 7 that they wanted to do what they're doing. And then there's people who are like, I wanted to do something completely different. And like you were saying with the Yiddishkeit and the Orthodox stuff, kind of fell into my lap and this is where I am.
Yeah, so I'm probably in the first category. I don't think I ever even thought about doing anything else. I tell people I wanted to be a pediatrician before I knew that that was like a doctor. Like if there was another school that you could go to instead of medical school, I would have done that. So I think growing up as an only child, I think really inspired that or fostered that a little bit because I was always, I really enjoyed being around children, didn't have an opportunity to be around children being an only child. And so the idea of being around kids all the time, I think was like very interesting to me. And then when I thought about like the different avenues where you could do that, right? You could be a teacher or, right? There's certainly other ways that you could work with kids. I like the idea that you could have a relationship with kids and with a family for a really long time. When you think about pediatrics, in like an ideal pediatric relationship, you meet somebody sometimes even in the delivery room, right, when they're fresh and born, and then you have an opportunity to be in their life, hopefully until they're 18, sometimes 21 years old. And so I think that idea really resonated with me, and it's also one of those things that kind of I felt like it chose me.
Wow. Okay. So did you have anyone in your family that were in the medical field or kind of? Okay, blazed your own trail. I love it. Yeah, I think you're very right, though. I went to my pediatrician for almost my whole life, and then my siblings went, and I know my mom had the same experience with hers. It's definitely a relationship that's like strengthened throughout the years, for sure. Okay, we're going to talk about so much that you've achieved in your career, your personal life. I'm curious if there was like a particular challenge or obstacle that shaped you into the person you are today. It's okay if not, because again, the theme of today, I think, is that there's not always that specific moment, but I'm just curious.
Yeah, I don't know about like a specific, again, almost, I guess I would say anticlimactic, but certainly in a good way. I would say going to medical school, and I was, already married at the time. Being a frum woman, a frum married
Yeah.
woman, was certainly a challenge. A lot of my colleagues and people that I've met, like through JOWMA or other organizations that I've worked with, when you train, I think in places that have more of a prevalent from
Mm-hmm.
community, I've found that it's probably a different experience.
Yeah.
Like it's normal when 20 kids need off for Yom Tov. I was in medical school with three other from
Yeah.
boys. I was the only from girl, and so that was a challenging experience, a rewarding one. But I think it really solidified my
Yeah.
hashkafa and my, I think, confidence in asking for what I needed,
Wow.
and using those skills also in residency. I was the only observant person
Yeah.
in my residency. Again, the only from woman. I already had kids at
Wow.
that time, and so was in a unique position compared to the
Yeah.
rest of my peers. And so having, I think, using what I learned in medical school in that situation, I think sort of helped me pave the way for being able to get what I needed during my training.
It's amazing. I had Dr. Sarah Rosenell. I don't know if you know her. I'm sure you do because she's
Yeah,
part of
of
JOWMA.
course.
So she was actually saying something very similar, that because she was a woman, because she was Orthodox, because she was a mom, and she had all these different things that she had to balance, she really had to learn how to stand up for herself and ask for what she wants. And I think as women, a lot of us struggle with that. And it's almost like a blessing to have to be pushed to have to learn that so that early on.
Sure. And I think also, like, especially for me, wasn't necessarily part of my
Mm-hmm.
personality. I wanted to be seen as like a hard
Yeah.
worker, and I still want to be seen as a hard worker. And so the idea for like asking time off when like you're
Yeah.
not supposed to have time off, right? Or needing accommodations, leaving early on Friday, not being able to eat what everyone is
Yeah.
eating. I really had to go out of my comfort zone, and I
Wow.
almost had to. I mean, everyone experiences, women, Jews, etc. Like any, I think, minority in any situation has the experience where when you need to ask for accommodations, you need to ask for something for yourself that others may perceive as
Yeah.
being
Yeah.
lazy. You have to spend the rest of that time
Yeah.
overcompensating.
Absolutely.
So I think a lot of us end up becoming really excellent in what
Yeah.
we do as a result of like pushing harder than we otherwise would have, because we want people to see us for
Yeah.
being strong
Such a
workers.
good point. I know for myself, like when I went to college, I constantly felt like I had this chip on my shoulder because I'm like, if I chose to go to college by myself and I went to California and pursue that on my own, I felt like there's no way I can fail because otherwise, what am I doing? I just had,
A lot of
yeah.
pressure.
So I totally can relate to that. You did mention JOMA. I want to start by asking you, can you explain to our listeners what JOMA is?
Yeah, John was another one of the things that again found
I
me.
love it. I love it.
Somehow I just kind of go through life. God sends
It's
me things that I
amazing.
need. Thank God. So JOWMA stands for, it's Jewish Orthodox Women's Medical Association. It's an organization that has a few different goals. One of the pillars is mentorship. So there's different avenues for Jewish women who are in the process, various points in their medical training,
Mm.
whether it's pre-med. So there's even like a program to mentor high school students in medical school, in residency and fellowship, and like early career. And then there's also a community health piece, and that's the part I'm really involved in, where we do a lot of community education through all sorts of different avenues in order to try to reach, our community, which may not necessarily have access to the types of
Yeah.
information that others do.
I recently learned about this when I reached out to you. I was so amazed because I didn't know that this was out there. When did it start?
So it started a few years ago, I would say a couple years before
Mm.
COVID, but I think COVID really like launched
Yeah.
it because fortunately or
Yeah.
unfortunately, there was a lot of opportunities
Yeah.
for health education at that
Yeah.
time.
And you're the director of education.
I am, yeah. So what my role is, one is I host the
Yeah.
podcast. That's a big part of what I do. And the other piece of it is putting together talks for various
Mm.
Jewish communities that it's usually delivered by other physicians or specialists within their communities to be able to provide education to, places that would benefit
Yeah.
from that or that it would resonate with. And then I also write articles on behalf of JOWMA in Mishpacha and very similar publications. Again, just focusing on health and a lot of
Yeah.
preventative health.
And just as a side note, this is not your full-time job. You still have,
No,
yeah.
it's my side
It's really
gig.
wild. I was reading your bio. I'm like, this woman just does so many things, and we're going to talk about that in a little bit. But I want to start by asking you, I read an interview about the Orthodox community, and what you stated is that it's really good at reacting to illnesses, but not as focused on preventing it, which I found very interesting. Can you elaborate on that?
Yeah, I actually remember that interview very well. It was for the OU magazine. It was like I think an issue they did around Pesach time where they wanted to focus like on I don't know, gut health, and then it took this whole like preventative health turn. So it was probably a controversial statement, or
Really?
at least felt that way. I don't know. I didn't want it to seem like we didn't care about prevention, but at the same time, I'm a physician in my
Yeah.
community, and I work really closely with a medical referral organization, right? Big communities have these organizations
Yeah.
where if God forbid somebody's sick or they need, I don't know, a specialist, a surgeon,
Right.
something, right? They reach out to these organizations and they're able to help expedite either an appointment or get them to quote unquote the best specialist or get the medication they need. And it's really an amazing chesed that
Wow.
communities have. But at the same time, I realize that I think as, I don't know, as a people, will do just about anything, right? If somebody's
Yeah.
sick, we will go to any length necessary, do any experimental treatment if we think it has a chance of keeping us healthy and keeping us around. And I think it's a beautiful value. But there seems to be like a lot of emphasis placed on
Mm-hmm.
that and very little emphasis left over for anything
Yeah.
else. And being a pediatrician, a big like fundamental piece of general pediatrics is prevention. It's one of the things that I really enjoy by taking care of kids because you haven't gotten to the point yet, right, where maybe someone has developed a chronic
Right.
disease. Certainly kids have them, but much, much,
Right.
much less. And so I felt like, oh, when you take care of kids, you have an opportunity to instill good habits that can prevent or significantly delay the onset of
Yeah.
chronic disease. And I just felt like there wasn't a lot of talk or effort or thought being put into how we can incorporate
Yeah.
those efforts, those habits
Yeah.
as a
Yeah.
community.
Really made me reflect. I'm curious, do you think that it's truly like different in the Orthodox community, or maybe because we have so many different avenues to help people once there's something happening already that the contrast is so clear?
I don't know.
Mm.
That's a good question. I don't know because again, that the OU article that had asked a question, I think they were trying to make the case for like, in Pesach, we eat so much matzah and is it really healthy?
Oh,
And
interesting.
our diets healthy, right? As like,
Mm-hmm.
I don't know, Jews, like is cholent healthy, all this stuff. Like, do we have sedentary lives where, we try to find a house as close to shul as possible? And I guess maybe a little, but I've been to so many homes where people are very, very healthy
Mm-hmm.
eaters, right? Or they walk a lot. Like think about how much we walk on Shabbos
Yeah.
and Yom Tov, like right. Otherwise, I don't think we'd be moving as much. So I think you're right. I think it's probably that the contrast is so visible because we do so much if in our efforts to react to
Yeah,
disease.
but that makes a lot of sense. JOWMA's podcast, and this is a quote, shares preventative health information geared to members of the Orthodox Jewish community. And I'm just curious. So, for context, not all our listeners are Orthodox. Not all my guests are Orthodox. I just have one theme, Jewish women. So, I want to ask you, why does information need to be geared specifically to the Orthodox community? Like, what's different there?
It's a great question. I actually used to have kind of like mixed feelings
Mm,
around it. I think when I first started community health work, I was of the mindset that like you just need to find somebody who knows and understands the information really well and can give it over in a relatable way. And that person doesn't need to even
mm-hmm.
be Jewish.
Right.
Like why? And I start as I worked with the other people in JOMA, people who have done work in community and public health, have degrees in public health, I realized that like a fundamental piece of
Mm-hmm.
effective public health is having the information being given over by somebody who looks like you,
Mm-hmm.
by somebody who can relate to you, and especially in I hate to use this word, but like in some more insular
Yeah.
communities. Like casitas places and things like that, it's all the more important to have somebody speak to a group that looks like
Right.
them, that can relate to them, and make it more impactful. One of the most, I think, well attended lectures we had in JOMA was a couple of years ago. It was at the Borough Park JCC, it was a lecture for men, and we had, I want to say, an optometrist come and talk about eye health to other men, and he gave it over in Yiddish.
Wow.
And it was huge. I mean, talking like standing room only. I've
Wow.
never in my life had a lecture where people came and it was standing room only when
Wow.
I'm speaking. And I realized it was really important. The other experience that I had that I think like solidified this concept that it has to be
Yeah.
relatable is when I went to Borough Park and gave over a talk. And as frum as I think I am, I'm certainly
Yeah.
not like Borough Park Hasidish frum. And that became very
Yeah.
apparent when I walked into the room and they were like, who's this
Yeah.
lady? And it was a wonderful, engaged audience. But even the questions that they were asking made me realize that, like, wow, it's really, really important to have somebody here who understands like this type of
Yeah.
lifestyle.
I think I was a sociology major, so I totally understand it from like an objective point of view. I'm curious specifically about the questions they're asking. So I want to ask you about like mental health and wellness. And I don't want to either be like controversial here, but I do know that it's less talked about in insular communities like you mentioned. How do you how do you and JOWMA like approach those conversations?
So, all the more so, I think it's important to have that information come over in a culturally
Mm-hmm.
sensitive way. And so, I think JOMA has done an amazing job of bringing issues of mental health and wellness and vaccines and things that I think maybe other
Yeah.
organizations shy away from in a way that's been received really positively. I will tell you, like, it's really, really not
Yeah.
easy because when you talk about objective health education, it's totally normal to use like anatomic
Right.
descriptions, right? It's not seen as like as bad, but when I'm putting together, let's say, a pamphlet on the HPV
Yeah.
vaccine for JOMA, which is a vaccine that prevents cervical cancer, you can't
Right.
say cervical,
Right.
right? You have to, and you have to be like very intentional
Yeah.
about the words that you're using and how you're delivering that message. So I think it's another really, really strong reason to
Yeah.
have organizations like JOMA like continue to sort of push the envelope on these really important
Yeah.
issues.
Wow. In your experience, what are some common misconceptions within the Jewish community regarding health, if there are any, and how do you work to address them?
Think there's a there's a lot of misconceptions, I think everywhere,
Yeah,
right?
absolutely.
Even in I think sometimes like the more access we have, the more access to
Yeah.
misinformation we have. So I think that's a big part of the job is keeping up to date on misinformation, which
Yeah.
sometimes feels so uncomfortable, and being able to confidently and accurately
Yeah.
address it. So, misinformation around vaccines, misinformation around like even I think healthy eating.
Mm-hmm.
I find that there's a lot of like kind of noise and nonsense, misinformation around safety and why it's important to like use car seats properly and helmets and not give kids alcohol, things that sometimes may seem like normal for us,
Yeah.
but the truth is they're very, very unsafe. And so sometimes that's the challenge is kind of giving people information that may feel uncomfortable because it doesn't align with the way they've been living their life, but doing it in like a non-judgmental way.
Wow. Seems like it's a lot of the job for you. Yeah, it's so
Oh,
interesting. So, I want to ask you about the podcast a little bit more. Can you tell us about the conversations and topics it covers, and also like what inspired a podcast avenue?
yeah. So my predecessor, who I inherited the podcast
Yeah,
from, Dr. Alyssa Minkin, who's an amazing, amazing pediatrician, and I tell people she's my mentor.
oh,
She's my life mentor.
I love it.
So she was very involved in health education right around the time that COVID hit. Right prior to COVID, there was a big measles outbreak, and that
Mm,
sort of prompted a lot of the work that Joma was doing. And we found that there was a need for we had a hotline, like a vaccine hotline or measles hotline that you could call and get information. And we were finding that a lot of people were calling, and then the hotline, the intention was it for it to be staffed by people who could answer questions, but a lot of people were calling and hanging up. And so what we realized is
mm,
people were calling because they didn't really have like a Shiloh or a
yeah,
question. They just wanted to hear information. And so we realized that there was maybe an opportunity for us to share it out in that avenue. And so she started the podcast. It was a preventative health podcast, still
yeah,
very much is. And a lot of her work, all her seasons really, there was a big focus on all things that you're mentioning, right?
mm,
Mental health, wellness, things that really nobody else was talking about, certainly not in like a Jewish
yeah.
context or a firm context. And I've been hosting it for actually a year.
That's amazing. You mentioned still very much is about preventative. Has it shifted a little bit?
It shifted only because my personal interests
Okay, I
are
love that. You got to bring the personal stuff.
yeah, so Dr. Menken was very, very focused on mental health. It's a lot of
Mm,
her practice. She's a practicing pediatrician, and so the population she takes care of, it's like a lot of what she does, and so that was like very much in her wheelhouse. I have tremendous respect for
yeah.
that, but my focus has been a little bit more on prevention in other ways,
Hmm.
like prevention of chronic disease and like general
Yeah.
health information. And then because my personal interests are like exercise and things like
Yes.
that, the running joke is how many times can I get a guest to like talk about running or
We're gonna be
exercise
talking about that.
in a in a preventative health lens? And so that's maybe like the kind of
That's
twist
very
I've
interesting.
put.
I went through the episodes. You have such high caliber guests. It's really incredible, and it's like very very broad in terms of like the different topics. So I find it very interesting. How has JOMA evolved since you've been involved?
Oh my gosh. I feel like it's grown so much. I feel like when I look back on the things that we were doing, I got involved kind of like at the height of
Hmm.
COVID. And I feel like it's like 5x
Wow.
in size since then. It's done. I would say like the biggest change that I have seen personally is its influence outside of the Northeast, right?
Mm.
So at the time, um, overwhelming majority of the leadership was based in New York, New Jersey, and so that's where all the things were happening. And now it has a national reach. It's
Wow.
doing events in Miami, in LA, hopefully in
It's
Chicago soon, in
incredible.
Baltimore. So it's been very, very cool to
Wow.
watch.
Like something that I'm learning about through this podcast and hosting other people. Like I mentioned, I don't have only like religious women on the podcast, but when I do, like Dr. Sarah Rosenall, Alex Flexer, you, I'm like noticing how much the Orthodox community is evolving in terms of having conversation. Like I just remember when I was like 16, 15, 16, there was really nowhere to turn to for information. Or like when you had a question, you're like, why am I thinking about this stuff? No one's talking about it. I must be crazy. I must be weird. And I'm just imagining being a 17-year-old now and having all these like different platforms and different places I can go to. And I just find it incredible. I find it so inspiring. And I'm so happy that it's changed and evolved in such a way. It's so beautiful to me. And I'm like, very, even though I'm like, don't necessarily know where I fit into, in terms of the communities, I feel so proud that like people like you and all these other Orthodox women are doing such incredible things. So thank you so much.
That's beautiful, Faye. Thank you. Yes, I would agree. First of all, those are very cool people that you
Yeah,
just
they're
mentioned. So I
amazing.
love that you added me
Thank
in a sentence that mentioned them. That was very exciting for me. I think you're right. I think there's a lot of really, really cool stuff going on. I think the flip side of that is, like I mentioned, right? The more access we
yes.
have, the more like
Yeah,
misinformation comes out. And so, yes, you can have people who know what they're talking about, who, right, will share that over. But then because there's no like filter, there's no one
absolutely.
saying like, yes, you can talk, and yes, you need to maybe do some research before you
Yes.
talk some more. It's kind of like a free for
Yeah.
all. I find that sometimes it can be really confusing.
Absolutely. And I think that's in all aspects of life. Sometimes you have to go to the other side of the spectrum to find the balance, like you have all this information. And again, it's not just for the Jewish community. And then you have to figure out for yourself to do your own research, right? Which is something also that comes up in this pod. There's so much noise. We get lost in it at all times. So I think it applies to everything. It applies to fitness. It applies to food, everything you're saying. So yeah, I think sometimes though it's good to push it a little bit and then come back and figure out the middle ground. So I'm just glad it's going in that direction. Um, you have a very, very impressive range of roles, like in all different ways. You're the director of education at JOWMA, a pediatrician, you're a wife, you're a mom, you're really into fitness, you're a marathon runner.
But so I'm just going to interrupt
Of
you right there.
course.
Half marathon runner.
Oh,
That half is a really important word.
see, this is telling you how much I know about this. I'm not a runner. I'm really into fitness, but I'm not a runner. Maybe you can give me some advice. But that's the one thing I cannot get myself to do. First of all, how did you get into fitness?
I love that you think of that. I'm into fitness. That also makes me really happy. Um, I feel like I was always really
Mm,
active. My parents were both very much into like exercise as just like a normal thing
that's
that you do
amazing.
every day. One of my funniest memories I think is like right when we first came to America, like when immigrants come, like they don't really have
Uh-huh.
anything like. I think we maybe were like renting an apartment. My father was able to
Wow.
like get a car somehow. Like we had nothing. And one of the very first thing my parents did was they got gym
Oh, I
memberships.
love that. My heart.
Very much a
Yeah.
value. So I think, it was always instilled in me. I was active in high school. And then during, medical training is
Yeah.
hard. There's a lot. It takes a lot out of you. And so having like a healthy avenue, like I just needed that. I needed to be able to move
Yeah.
and take breaks. Thank God I was living in a beautiful place. I was living in South Florida. And so you could always, for the most part,
Yeah.
get outside in some way. And I think that like facilitated
I
that.
love that. I love fitness. I love like just getting outside. I think it's so so important. I want to ask you how you manage to do it all.
Yeah, I don't think I don't think I
Okay?
do.
That's a good answer. I want to hear about
No,
that.
I don't think I do. I think, first of all, I don't prioritize like a lot of things that I think maybe other people
Like
do.
what?
So, like for example, my house is like not that
Hmm.
clean, but I did a 45-minute bike ride this
Yeah.
morning. Like I could have used that time
Yeah.
to clean my house, but I was like, I'd rather ride my
Yeah.
bike. And so I recognize that that approach is like not for everybody, and you have to have a family that's like on board with that.
Yeah.
Or like the dinner that my kids are gonna have tonight, I made it yesterday, so that way I can like maybe lift weights
Yeah.
today before they get home from school. So that kind of stuff I think is like a big thing where you kind of just have to figure out like what's important to you, and it can't be everything.
I love that
And so I
answer. No, thank you for
yeah.
sharing that. I think that's so much more real than saying, "Oh, I planned this like this and like that." Like just not always can you do everything. And I think, but again, it comes down to your priorities. If your priorities are this, this, and this, and you accomplish them, then you did everything. You know what I'm saying?
Right. I think, time is magical. I read a lot about like time management and thinking about time. I just think it's like such an interesting concept. Time is magical. It'll stretch to cover. It's like a rubber band, right? Whatever you need to do, it kind of like stretches to
Yeah.
cover. Like the common example that's often given in like time management literature is that like if you have your day planned, but then let's say like a pipe burst, you have some kind of
Yeah.
plumbing issue, right? Some emergency, like you didn't have it planned. You didn't think you had time for
Yeah.
anything that day, but like all of a sudden now you do.
Yes.
I just think that thinking ahead like that and being like, okay, what's
Yeah.
important? Creating backup spots for things that matter to you. The other like I don't know, not like hack, but again, like a running joke for people who know me really well is I go to sleep super
Me too.
early. I go to sleep before my like older kids go to sleep. Like
Mm,
they tuck me
I love
into bed.
that. I'm the same
Um,
way. It's kind of
yeah,
embarrassing for me.
it is,
Yeah.
it is. And then somebody once asked me like, okay, but like, what happens if you want to go out? And I kind of just
Yeah.
don't like,
Yes.
right? And so again, because I decide like it's more important for me to be able to
Yes.
like wake up in the morning and have my exercise time in the morning than for me to like stay up late or go somewhere. And
Yes.
again, that may not work for everybody. So you have to decide
Yeah,
what's
oh,
important.
I relate to that so much personally. My friend is getting married and we went out and we got home at 11 and the next day I was not functioning and I just
Happens like the middle of the night.
yes, I'm in bed super early. I also find that I don't know if you're the same way, but I get more done and I know a lot of people have this when I'm busy and it's kind of like the psychological thing. When I my day is empty, it's hard to like just break that like laziness and go and do something. But when you're on go, 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 somehow I always manage to do whatever I need
Yes.
to do.
I agree with you because I think go, go, go forces you to
Yeah.
plan. One thing that I do a couple times a year is I track my time, where
Oh,
I use a
interesting.
spreadsheet. This is a concept I learned from Laura Vanderkam, who's a time management
That's so
author,
cool.
where you have a spreadsheet and it's in like half-hour increments,
Mm.
and the x-axis is day of the week, and the y-axis is like time by half-hour
Wow.
increments. And so it forces you to be like, wait, what did I do
Yeah.
for like between like 7 p.m. and 10 p.m.? And when I first start doing this, it's just a question mark, question mark.
Yeah.
Like I could not for the life of me tell you, which probably means it wasn't very like important, right?
Yeah.
Or meaningful. So whenever I find myself like slipping a little bit in my
Yeah.
productivity or accomplishing what I need, I'll force myself to track for a couple of weeks, and then I go back and I'm like, oh gosh, I'm spending so much time doing like
Wow,
X,
that's
and
so smart.
I kind of want to do that. So you kind of like catch yourself doing it next time, and you're like, no, no, this is what happens.
That's
I
so
fall down like
cool.
rabbit hole, and I'd rather like read a book
Yeah,
instead.
that's
So
very smart. I had that when, like 4 years ago, I got off social media because I was finding that, let's say, 7 to 8. I'm like, what did I just do? And I realized I was just scrolling on my phone. I have no idea what I just saw. I was just
yeah,
mindlessly scrolling, and I hated it because again, I'm like you. I like to fill my time with stuff that matters to me, and so I went off social media for a long time. But it's the same concept. I really love that. And it's very actionable advice, also.
yeah, I love time tracking. There's a book that I really love. Again, Laura Vanderkamp is the author. She writes a lot about
Mhm.
time literature or time management. Her book that recommends kind of like concrete, actionable steps. It's called Tranquility by Tuesday. And actually, one of the
Mm.
things is what you and I already do, which is you go to
Yeah.
sleep really early, or if she calls it give yourself a bedtime,
Yeah.
because if you're kind of like, you know, if you control that a little bit, you find that you actually maybe do have time for the
Yeah.
things that you.
Yeah. Can I ask you how you feel about the word balance?
Hmm. I think it can be dangerous, I think, for someone who's working really hard to like quote unquote have
Yeah.
it all, feels like they can't, and then it just makes them feel like it's one another thing that they're not good at. But I think balance in the classical sense is really important. Balance means like kind of what you and I are saying, right? You have time for the things that matter to you. But it's important, I think, to acknowledge that it looks very different for everybody, right? So, like you and I are talking about go to sleep early and waking up, exercise, and maybe like somebody doesn't want to do that. Maybe it's
Absolutely.
really important for them to have a sparkling clean house, or like really, really fancy homemade dinners in the evening. And that's what they want to spend their time doing. And that's their balance. And that's perfect. That's
Yes.
amazing. It can't be the same for
Yeah,
everyone.
I think that is so important. I remember this year. My life has changed drastically. I got a way more demanding job that I absolutely love. I started the podcast. I got a puppy. I have a cat. I'm trying to get them to get along. Like my whole life has changed, and
Yeah.
suddenly I'm losing things. And I am somebody that would never misplace things. It was like something I prided myself or never forget anything. And I called my mom one day because I lost my AirPods, and I was so hard on myself for losing my AirPods because that's just the type of person I am. And she's like, Faye, this just means that you have a much more fulfilling life now. You're doing things that are filling up your day in different ways. And okay, so you're gonna forget your AirPods. And she's like, this is what I was trying to tell you when you used to make fun of me for losing my stuff. I'm like, how can I think about making dinner for you and then also remember where I put my glasses? And it finally clicked for me that that's just life. Like sometimes different things are gonna fall off, and they're not stuff that matter. Okay, so I lost my AirPods. I found them. It's okay. What's my priorities? And I think what you're saying is it looks different for everyone, but also it could change in different chapters of your life. It doesn't always look the same. And for me to be hard on myself on what it looked like when I was 18 doesn't make any sense because my life is not like what it was when I was 18.
I think that's really insightful and hopefully very validating for people to hear. One thing that's been really helpful for me is like finding a group
Mm,
of people who are like have similar things
yes.
that are important to them, and whose schedule
Yes.
and kind of like life chapters are relatively aligned with
Right.
mine. And it's been really helpful for both
Yeah.
accountability to make sure, right, I do the things that are important to me, but also like having a sense of
Yeah.
community and being able to see like others fail or struggle in the same
Yes.
way that you are, because I think it makes it a lot more likely that you're
Yeah.
gonna have the resiliency to
Oh,
overcome it.
that's so beautiful. It's also like you were saying, validating. It's very validating to me that you were very honest and you said, I don't do it all. Like, that makes me feel better. So, thank you. I want to end off by asking you something that I ask all my guests, which is, what does being a trailblazer mean to you?
Oh wow. I don't know that I would consider myself a
Do you know how many
trailblazer.
people I have on the podcast that say that? And I'm just like, okay, well, I do. I
Right. Well, I
consider
guess
you.
I'm here, which is cool. So I think it means um, being really intentional with how you live your life
Mm,
and how you spend your time, because we're all here for a reason. We all have the tools
yeah.
that we need in order to accomplish what we're supposed to. I think that the work and the challenge is like meditating on that, figuring
Hmm.
out what that is, and then going forth and
Yeah.
doing it.
And it all ties back to what we talked about today. Yeah. Thank you so much, Jenny. This was such a pleasure.